Thanks for staying with us. Now, it's Women's Month and we continue to celebrate phenomenal women making big strides in their field. Today, we zoom into the kind of work healthcare workers have been doing and appreciate their resilience during the COVID-19 pandemic. Doctors and nurses have been playing a significant role in taking care of our nation, leading change and supporting the next generation of women in health. We will be speaking later on to Dr. Brenda Khubheka, who's the founder and CEO of Matched Media and MD at Health IQ Consulting, to discuss this. We've unfortunately lost, we are back with her. Thank you so much for your time, Dr. Brenda. We do appreciate it. I think let's just start off with the phenomenal role that women play, especially in healthcare. We know it's not easy. We know that resources are limited and circumstances are sometimes very difficult. But how important is it for us to appreciate the kind of work that women do in healthcare?
Thank you and good afternoon. I think it's important to acknowledge the female. I mean, if you look at the global statistics and the workforce when it comes to health, more than 70% of the workforce is actually female. So it is important for us to actually acknowledge that. And today we're actually celebrating the phenomenal women in healthcare and the role they have played and they are currently playing as well.
I want us to speak about the kind of treatment that women are subjected to on a daily basis, never mind just in health, but in almost every sphere of life. Women are sometimes not given the same opportunities, not treated with the same kind of respect or regard. And this sometimes really causes an obstacle and challenge for women wanting to enter spaces that are often male-dominated or, breaking those glass ceilings.
We're actually having discussions about the same issue today, and I think it's important to also reflect and look at where these health space coming from. It's how we socialized and also the power dynamics that come with how girls and boys get raised, and that also going into the work space. So it is important that we acknowledge this, and then we also create platforms where we empower the women and also we assist the women and also create those channels and also for men to understand the role that they can play in creating a conducive for women to thrive in the workplace. So basically we're saying let's go beyond mentoring women, but we're saying they must sponsor women, which is open doors and dismantle the walls and create the channels for the women to actually thrive and do more and ascend in organizations.
Do you think enough is being done, though, Dr. Brenda, if we're really being honest and if we really want to have a frank conversation about how women are treated and the opportunities women are given? We hear of these horrific stories about how women are not given the same opportunity, are completely disrespected and disregarded in a workplace. And as much as, healthcare is more of a woman-dominated space, there's still that treatment. And it's one thing to mentor and sponsor, but it's another thing to try and change the narrative and the conversations that are being had amongst men about how women are treated. Do you think enough is being done despite mentoring and sponsoring?
I think we can actually do more and also empower both the men and the women on how to create this environment that is conducive for women to excel in the workplace. So if we look at, I always make an example of a program, Women in Leadership, and we don't see programs for male executives to actually support women in the workplace. So I think we need to reflect from the workplace, in institutions, well, to reflect as to what is the role of these institutions in making sure that everyone understands the role that they need to play when it comes to women empowerment.
Okay, great. And just lastly, I want us to speak about, we just spoke to whistleblower Babita Deokaran's family, and she was gunned down last year working in the healthcare space, doing very important investigations into COVID-19 PPE corruption. And she was gunned down because of the vital work that she did in Women's Month, being a woman in a space that clearly was a very dangerous space and very risky. We also speak about the nurse that was gunned down earlier this year at Tembisa Hospital, if I'm not mistaken. She was on duty, and it's alleged that her ex-boyfriend, who's a police officer, called her out and shot her dead. So the spaces that women work in, especially in healthcare, seem to be very volatile and dangerous.
The healthcare space, the people that work there and the people that come from outside, they come from the society. So it is the reflection of the violence that is in the society, or the tension also between the two genders that is also showing up in the workplace. For the workplaces to understand the vulnerability of women in those spaces and ensure that there are safety mechanisms that are actually put in place, keeping that in mind that women need to be protected, whether from violent patients or from even colleagues. You talk about harassment and maybe even microaggressions that some of the research showing that women professionals are experiencing in the workplace.
Okay, thank you so much for your insights. We do appreciate it. That was Dr. Brenda Khubheka, founder and CEO of Matched Media and MD at Health IQ Consulting.